A growing number of countries are exploring the option of vaccine cocktails. It involves administering different COVID-19 vaccines for first and second doses. Several medical studies to test the efficacy of switching COVID-19 vaccines are being held, but the reasons may also vary, from vaccine supply delays to safety concerns that have slowed vaccination campaigns. Clinical trials that combine doses of AstraZeneca's shot and Sputnik V are also underway, using a technique known as heterologous boosting. At the same time, several countries have given a nod to vaccine cocktails under special circumstances. Let's take a look. In Britain, the first findings of an Oxford University-led study in May found that people who mixed AstraZeneca's vaccine with that of Pfizer developed milder post-vaccination symptoms than those who received the same doses. Earlier in January, UK had allowed people to be given a different vaccine for a second dose on extremely rare occasions, for example, if the first vaccine was out of stock. Spain is also giving those under the age of 60 the option to get a second dose of either AstraZeneca or Pfizer vaccine. A study on mixing COVID-19 vaccines run by Spain's state-backed Carlos III Health Institute found that giving a dose of Pfizer's shot to people who have already received the first shot of AstraZeneca's vaccine is safe and highly effective. Now to France. France's top health advisory body, Haute Autorité de la Santé, recommended in April that people under the age of 55 injected with the first shot of AstraZeneca vaccine should receive a second dose with a so-called messenger RNA vaccine, like those made by Pfizer or Moderna. However, dose mixing has not been evaluated in trials in France. Norway and Sweden have made similar announcements. Finland has adopted a similar strategy, but that is primarily driven due to concerns over vaccine availability. As for Canada, in Canada, officials said in May that people who were inoculated with AstraZeneca's COVID-19 shot may be offered a second dose of another vaccine. This is a move based firstly on supply concerns of the AstraZeneca shot and secondly on safety concerns due to a rise in incidence of rare blood clots linked to first doses produced by the Anglo-Swedish drug maker. A few days ago, South Korea announced it would run a mix-and-match trial of COVID-19 vaccines, mixing AstraZeneca doses with those developed by Pfizer and other drug makers. While in the United States, the CDC has updated its guidance in January, allowing a mix of Pfizer-BioNTech's and Moderna's shots with a gap of at least 28 days, but only for exceptional situations.